suitcase, okay? They really didn't put this correctly. But this is supposed to go like so. And then that's supposed to be wrapped up. So these are your lead wires, okay? And then this would attach to this, and this would attach to the computer or the laptop, okay? And then these are your electrodes. Remember, with your electrodes, they always have to stay in its packaging to preserve them, or they won't work properly, okay?
Like sticky.
They need darkness because the electrolyte is sensitive to the light. So you'll keep them in there. They have some extra alcohol swabs in case somebody has, you know, maybe they have extra oily skin, or they sweat, or they put on lotions or body oils, what have you. You would clean that area off first and then stick it on there. Okay? All right.
I have a question. Otherwise, we have a hairy chest.
So, yes, you will see that, especially with your men. In our office, we had to dry shave. So, I kind of gave the men an option. I said, we can either dry shave, or what I would do is I would take an electrode and place it and then rip it off. So it was either that or dry shave. They usually did the dry shave. So.
Yeah. What?
Because what ended up happening, sometimes they didn't want either, and then I would try to like separate the hair and try to get it into a good spot, but I mean, it has to come off. So when it was time for it to come off, it, you know, it was a struggle, but we got through it. So that's what you would do. All right. Now, with these, this one should have a card, but you'll have like a card like this, okay? This one helps with placement, okay? So you have the PowerPoint, you have your book. This right here kind of tells you, you know, where the placement would be for the chest leads. I'm going to have my method, okay? So you can, if that works for you, you can do it that way. If this works better for you, do it this way, okay? There isn't really one set way, okay? But there is a foundation you need to stick with. Never put electrodes on bone, okay? Because it will not pick up any kind of electrical activity from the heart, okay? The bone blocks it, okay? So when you're putting your limb leads on, because you'll have one on each arm, one on each leg, you need to make sure you have the fleshy part, okay? When it comes to the chest leads, you need to make sure that you are in a intercostal space. Intercostal, does anybody know what that means?
Between the ribs.
Exactly, between the ribs. So if you just go like this is your clavicle, right? Right underneath it, you'll feel a divot, okay? So go ahead, you can do it on yourself. That divot is called an intercostal space, okay? And then you move down, so that's intercostal 1, intercostal 2, intercostal 3. So when we say 4th intercostal, you're counting from the top, 1, 2, 3, 4, okay? The space in between the ribs, okay? All right, we all good? Next thing. Some places may put the limb leads down here or up here. Sometimes they may put them on the wrist, okay? I'm gonna show you the foundational part, and then when you go into the medical office, whatever they show you is fine. It does not mean it's wrong, okay? So limb leads may vary, okay? We're going to put them on deltoid and then the inside of the bottom of the feet, Okay? Okay. All right, now I'm gonna go ahead and begin. I'm just gonna put this actually right up here. The doctor has already seen the patient. The patient's waiting for me in the room, okay? And I've received orders from the doctor that the doctor needs an EKG. So my first thing is I'm going to gather my supplies and I'm going to speak to my provider. Hi provider, I've received the EKG order. Would you like a blood pressure checked? Okay, that's the first thing you need to ask if a blood pressure needs to be checked. Okay, I most likely will say no. Okay, all right, thank you.
Oh, that was it?
Huh?
That was it? I
That
thought
was
it would be way more.
No, that's
Okay.
it. That's it. Then you're gonna go in to see your patient. I come in. All right. Hi, Mr. Smith. How are you today? I see that Dr. Who has ordered a EKG for you today. Is that correct? Okay. Before we get started, I need your first and last name, spelling, and date of birth. Okay. Thank you very much. All right. So, have you ever had an EKG done before? No? Okay, so just to kind of give you an idea of what's going to happen is I'll go ahead and ask you a couple questions first, and then I'll have you undress. I'll step out, have you undress, come back in, and then I'm going to put some electrodes. They're little mini stickers that have tabs on them. I'm going to put some on your chest, some on your arms and legs, and then we're going to have some wires that I'll hook up to those stickers. And this is going to be a painless procedure, okay? There is no pain involved, but I will need you to completely lie still and not speak, okay? Do you have any questions for me? Okay. So a couple of things that I need to ask you about is, do you have any lotions, body oils, or anything like that? What about any piercings? So you need to make sure that you ask about piercings. Maybe they have a big belt buckle on. Maybe their phone is on them. Okay, is your phone on you? No? Okay. So all of those things can interfere with the electrical impulses that are needed. Okay. Now, if they have like a little belly piercing, it's not a big deal.
Like this.
Now, yeah, if they have their nipples pierced, their belly pierced, something else pierced, like if we're going piercing crazy, then we're gonna have to say, okay, I'm gonna need you to remove X, Y, and Z, okay? And just put them on the side or whatever, okay? Usually I'll put out like a paper towel and I'll just kind of set it off to the side.
Now, what
And I'll
if
say-
they refuse to say, no, I don't feel comfortable, not feel comfortable, I can't take away my piercings?
If they refuse, fine, we're gonna do the best that we can, and then you're going to report it to the provider.
Got you, okay.
You're gonna put it in the note, like in the EHR, or write it and say, patient refused to remove piercings as directed.
Okay.
So this way the provider knows.
Why
If
am
that
I coming
report
in?
is all weird and wonky, then we know why.
Yeah, okay.
All right. Okay, so a couple more things. Do you have a pacemaker? Are you on any heart medication? Okay, and do you smoke? Okay, all right, so I'll go ahead and take out a gown and a drape for you. Gown. And here's a drape. And I'll step out for a second so you can go ahead and get undressed. So I just need you to completely undress from the waist up. If you have a sports bra on, you can leave that on as long as there's no underwire in it. Have the gown with the opening in the front, okay? And you can use this drape to drape yourself. And I'll be back in shortly. I'll grab my medical record, phone, step out, wait for them to get undressed. Now, all cameras will need to be turned off because I'm going to need one of y'all to volunteer.